Hey everyone, welcome back to my channel. It's Dr. Alessandro, and in today's video I'm going to be kind of answering a question that some patients every now and again ask, or maybe my reply to some of the commentary. They say, hey doc, you must have perfect teeth. Isn't that how dentists are? And to answer your question briefly, the answer is no. Our teeth are not perfect. We do not have all perfect teeth all the time. In fact, some dentists have had fairly, you call it rigorous reconstructions of their mouths, and that might be part of what inspired them to become dentists. Or they may have had other dental experiences as children, which kind of pushed their curiosity and then ultimately led them to becoming dentists. So the answer is no. My mouth has not been perfect. And in fact, if you'll recall from one of the past videos, I do have a filling in my mouth, a silver filling in my mouth. And I can tell you that I've had a number of things done. Hey doc, your teeth are perfect. Well, I had a tooth that broke, a baby tooth, when I was young, and it had to be extracted. So I've had an extraction. I've had my wisdom teeth extracted, and that's because two of them did develop cavities, and then one of those two that had been ultimately filled developed some gum disease behind it. And when you're brushing twice a day and you're flossing every day and you're still developing gum disease behind a wisdom tooth, probably best to get them out. So I had my wisdom teeth extracted, yes, while I was awake, but I wanted to get the experience to know what it was like, to know what it was like for patients who are getting them and getting teeth out. So I got that experience. I've had braces. So I had braces. In fact, I had Invisalign to kind of correct crowding that happened after braces. So I've had all of that. So I've experienced a lot of different things that patients have, from having cavities taken out and fillings put in, to having teeth extracted, to braces, to experiencing gum disease, to experiencing, the cavities. And so I'm aware of a lot of the stuff that patients do, and I've tasted a lot of the same stuff. In fact, I tend to taste test some of the materials that we have, and some of the, for example, the mouth rinses that we have, or other items that we have. So I know what things taste like and feel like, and so I can actually convey that to a patient. Or, for example, our fluoride. We have topical fluoride, and so I can tell patients, yeah, it's going to smell pretty good, it's going to taste okay, maybe, sort of. And for our topical varnish, it's going to feel fuzzy in the mouth. So I like to be able to tell patients, hey, this is what to expect. That way you know what's coming, and to prepare them, and then to at least be able to relate well, because I've had many of the same things. So no, our teeth have not been perfect all the time. We all have things that chip. We've had our cavities. We've had maybe even, like I said, major reconstructions. Maybe some of our colleagues have come from other countries where dental care in early ages wasn't available, or wasn't widely available. So there have been more extensive dental needs that were ultimately met. But yeah, we're not all perfect. We don't all have perfect smiles. We all try to do what we can to keep things healthy, though. And that's really important. So there's your answer to the question. No, we don't have perfect teeth, but we certainly now try to keep everything as healthy as it can be. So again, thank you so much for joining me, and hope you're all staying well and healthy.